So tokophobia is a term that we use to refer to a severe fear of childbirth. So that can happen for women who've never had a baby before, never been pregnant, but also can happen for women who have had a baby previously and perhaps not had a good experience. So generally people will present with extreme anxiety and fear of having a baby, so that might prevent them from getting pregnant in the first place. It might mean that they manage to get pregnant but then choose to end a very wanted pregnancy. It might mean that they are very afraid during their pregnancies. They're more likely to ask for elective C-sections out of fear, and often aren't enjoying their pregnancy because of the anxiety of what's going to come when they have to give birth. So as with most things, I would always say get help earlier. The earlier the better. So even if you are not pregnant or haven't had a baby but you think that you would like one, but you're too frightened to have one because of the worry about giving birth, I would approach a GP in the first instance, and you can ask for a referral into Maternal Mental Health, which will look at supporting you with conception planning. Equally, if you've fallen pregnant either expectedly or unexpectedly and you're experiencing a lot of anxiety about giving birth, I would say approach a GP or your midwife, or your other options are your health visitor. If you have an older child under the age of 5, you can go through it via your health visitor. You can't directly refer yourself to perinatal services, but you can access it through another health professional. So approach them in the first instance and they can refer you. So initially, when you're referred to us, we will take a look at the referral form, and if we think that we're the right support for you, we'll offer you a face-to-face assessment. Now that might be in real life or it might be online. So we will meet with you for somewhere between 45 minutes to an hour and a half to talk about what it is that's going on for you and what we think that you need. And at the end of that assessment, our aim would be to give you an idea of what we think is going to help. And sometimes that will be that you receive treatment with our service, and other times it might be that you may need treatment with a different service, but our aim would be to have that conversation with you very quickly. If you're going to remain with us for your treatment, we have a number of options. For tokophobia, we hope that we see you when you're pregnant, because that's when the fear is likely to be impacting you. So we will support you to prepare for your birth. We have things like birth preparation meetings, which take place alongside specialist midwives who work in the services, might include your obstetrician. Our aim would be to ensure that you have choice relating to your birth. There's no right or wrong way to give birth. It's making sure that you're going to have an opportunity to do that in a way that works for you. So there'll be that. You may also get a combination of different kinds of psychological therapy. Some of that might be groups, some of that might be self-help resources. You may also access one-to-one psychological support, but each individual person will get an individual plan of care that we think is going to work for them. So the first thing is making sure you've got all the information. So a lot of it will be ensuring that you've got information, that conversations are being had, that you fully understand all of the choices that are being given to you so that you can make an informed choice. The other part of that might be something like CBT, or it may be that we offer some trauma work. So if part of the reason you're experiencing tokophobia is because perhaps you've had a traumatic experience previously, perhaps a previous birth that was traumatic, we may look at some specialist trauma intervention. Sometimes that's something that we call stabilisation work, which is about helping you to cope here and now, ready for your next birth. Sometimes that might be what we call more active treatment, so something like trauma-focused CBT or EMDR would be another option that we might look at.